Welcome, everyone, to our clinical update webinar, Living with Narcolepsy Type 1 and Understanding the Journey. We are delighted here to present this webinar to you. Our work with Axsome has been very valuable. We joined a research partnership in 2023 and along with a third-party research firm to present this research to you. It's the first partnership of its kind where a company partnered and delivers its findings to the larger community around the unmet needs of people with NT1. This groundbreaking study revealed the breadth and scope of symptoms that remain unaddressed for some people who are currently on medication. Please welcome Dr. Michael Thorpy from Montefiore Medical Center.
Thank you, Amy. I'm delighted to have the opportunity to present this survey from Axsome, which is entitled CRESCENDO. And it's a survey which helps us understand the burden and the impact of symptoms in people that are living with narcolepsy. So the CRESCENDO was conducted by a third-party research firm that worked with Narcolepsy Network to ensure patient privacy. Narcolepsy Network, as you all know, is a national nonprofit patient support organization for people with narcolepsy, idiopathic hypersomnia, and related sleep disorders. I'm a consultant for a number of companies that are producing medications for patients with narcolepsy and idiopathic hypersomnia, and the list is on the screen. And Axsome provided funding for this CRESCENDO study. Okay, so first of all, let's talk a little bit about the background on narcolepsy and the CRESCENDO study. So narcolepsy, as I'm sure you're all aware, is a long-term condition that affects the brain, where it has the inability to be able to control sleep and the ability to stay awake. And there are five main symptoms, which are called the narcolepsy pentad. They're shown on the left-hand side of a slide, and I'm sure you're all familiar with them. But excessive daytime sleepiness is, of course, the most prevalent of these five items. And then that's followed by abnormal REM sleep phenomena of particularly cataplexy, the emotionally induced muscle weakness that we see in patients with type 1 narcolepsy. And then there's sleep paralysis and sleep-related hallucinations that are also part of the pentad. And then we have disrupted sleep. In general, you can think of it actually instead of five things, which may be a little hard to remember all these items, but think in terms of three things: excessive daytime sleepiness, abnormal REM sleep phenomena, of which cataplexy is one, and then the disrupted sleep. But as we all know, and as you particularly know, there is more to narcolepsy than these five main features. There are other symptoms that are very common in narcolepsy. So trouble thinking and remembering, concentration, brain fog. And we're going to talk about that as we go through the survey. But also mental health issues, depression, anxiety are very common as well. And we'll discuss the findings from the CRESCENDO survey when it comes to looking at these particular symptoms. So there is a major impact of narcolepsy on the individual who has it. There's no cure, as you're aware, for narcolepsy, and it does affect everyday activities. So work, social life, education, everyday household activities, exercise, and relationships. And people with narcolepsy need to take medications in order to improve their symptoms. And typically they'll take a number of different medications. So it's more than one for most patients. And again, we'll show you information from the survey that illustrates that point. But the survey really is important to understand how to treat and care for patients with narcolepsy and understanding the patient's view on their own symptoms and how it really impacts their daily life. So this survey, the CRESCENDO survey, was done to understand the impact of symptoms on people who have narcolepsy, and to learn about new opportunities to try to help improve the care for people living with narcolepsy. So the survey included questions about medications, symptoms, the impact of narcolepsy on daily activities. And there were also questionnaires that were completed by the participants that healthcare professionals used to assess symptoms. And we're going to look at some of those results of those questionnaires as to how you answered them compared with how you felt the symptoms were affecting you. So the survey was done in partnership with the Narcolepsy Network to ensure that the voice of people living with narcolepsy was captured accurately. So here's an overview of what the CRESCENDO study showed, and I'll come back to these points later on in this presentation. So nearly all participants being treated for narcolepsy said that they continued to experience symptoms that impacted their daily life. And some of the symptoms look quite different when we looked at how patients felt about their symptoms compared with what the clinicians were rating their symptoms. And the CRESCENDO study highlights the importance of discussing your symptoms with healthcare providers. I think that's one of the main outcomes of this survey, is that it really emphasizes the importance that you speak to your healthcare provider about your symptoms, because the questionnaires, as you will see as we go through this, don't always capture exactly what you're feeling. Okay, so let's look at who the study included and what treatments the participants were taking. So there were over 200 people who completed the survey, and they were taking medication for the narcolepsy. The survey was completed in 2023. The average age of the participants was 41 years of age at the time of completing the survey, but their symptoms began when they were 18 on average. Now, we know that narcolepsy typically does begin around in the teenage years, between the ages of 16 and 18. For these participants, the mean age was 18. And as typical for narcolepsy, it wasn't diagnosed for quite a few years later. So the average time to diagnosis was 28 years. So it took patients many, many years. And as you can see from the slide, in fact, it took some patients nearly 70 years before they got a diagnosis of narcolepsy. So in terms of the medications that the participants were taking, what we found was that 53% were taking wake-promoting agents, 47% were taking oxybates, and as you're aware, there are 3 different forms of oxybates now, and then 42% stimulants and 38% antidepressants. So a variety of different medications being used. I mean, these aren't all in the same class. They're in quite different classes, but necessary to help improve the symptoms of narcolepsy. 39% were taking one medication, and a similar number, 30%, were taking 2, and a similar number, 31%, were taking 3 medications. So it's very typical that one medication is not sufficient for everyone, and that patients do need to take 2 or 3 medications. And this was shown in the survey. Now, almost 2 out of 3 people were satisfied with their treatment. Satisfied. And the reason for the satisfaction was because there was improvement in their symptoms. That was the most common reason. So in addition to treatment satisfaction through symptom improvement, patients also felt satisfied about their treatment because of their ability to complete more activities. And the survey showed that those that were taking multiple medications were more satisfied with their treatments than those that were only on one medication. 17% were actually very dissatisfied or very dissatisfied. So although 2 and 3 are satisfied, there are still a lot of people who are not comfortable or happy about the management of their symptoms with current medications. So as I mentioned, symptom improvement was the most important factor for people when thinking about starting a new treatment. And as you can see on the slide, 96% expected to get improvement in their symptoms. And you can see that large numbers of patients also found that important factors before starting treatment were the impact on their long-term health. They wanted scientific evidence that the treatment worked, and the potential for improving their mental health was also important. But they were concerned about out-of-pocket costs and about the possible side effects of medications. So the key takeaways on the survey participants and the medications are that most people took multiple types of medication to treat their narcolepsy. Almost 2 and 3 were satisfied with their narcolepsy treatment. And symptom improvement was the most important factor when people were thinking about starting a new treatment for their narcolepsy. Okay, so let's talk now a little bit about um, medication reporting and the symptoms and how those symptoms impact on daily life for the patients. So nearly everybody reported experiencing some symptoms while on current medication. So it's clear that the medication is not eliminating all the symptoms of narcolepsy. So 91% continued to feel that there was some excessive daytime sleepiness. So they're still sleepy during the daytime, and 77% felt that they were still having some cataplexy. But there are other symptoms, and these symptoms are not often talked about, but they're very important to you as patients with narcolepsy. So cognitive symptoms, difficulty concentrating and brain fog. Over 70% of the participants reported still experiencing these problems while taking medication. And then there's the mental health aspects too, the anxiety and depression that continues despite treatment for narcolepsy. So when it comes to cataplexy, the participants felt that cataplexy is a very embarrassing symptom that really causes a major burden to their professional, work, and social life. So 77%, as I mentioned earlier, still having some cataplexy episodes despite the fact they're on medication. Slurring of speech, it's something that physicians don't often talk about. But for you as patients, it's an important factor. 68% of the participants in this survey felt that this was really embarrassing and a major concern. Cataplexy, of course, is going to affect their work and professional life. Falling down is a terrible symptom and very embarrassing. Cataplexy also, they felt burdens their social life and burdens their everyday life. So cataplexy is really a major symptom that, unfortunately for many patients, is not fully resolved by current treatments. Now, most people treated for their narcolepsy still experience excessive daytime sleepiness. And I mentioned earlier that 91% of the participants still had some daytime sleepiness despite treatment. Now, if you complete a questionnaire that's typically used by physicians, in this case, it's called the Epworth Sleepiness Scale, it only comes out about 64%. So when physicians are using these scales to assess your sleepiness, they're really not picking up all of the features that are important to you as a patient. And then again, this is another reason to emphasize why it's so important for you to talk to your physician about your symptoms and not just have him rely upon questionnaires that you might fill out. 80% of the participants felt that excessive daytime sleepiness continued to have a moderate or severe impact on their daily life. And that's the reason why you need to bring it up and discuss it with your physician, even though you're on treatment. Now, 75% of the participants approximately had problems with mental functions, brain functions, such as concentration, brain fog. These are very common symptoms that patients with narcolepsy experience. 77% having difficulty concentrating, 77% with brain fog. And brain function was also assessed by one of the questionnaires that clinicians used. But when you looked at this results of this questionnaire, only 74% indicated that they were having a problem. But so again, it indicates that the questionnaires are not fully accurate in assessing your symptoms. And so it's so important, again, that you actually discuss your symptoms with the physicians. So over 75% felt that difficulty with thinking caused problems in their work and professional lives, pursuing hobbies, having good social relationships. And that you can see the percentages, a major percentage of the participants felt that it made it difficult for them to do works, school work, enjoying social activities, or their relationships with others. So these cognitive symptoms of concentrating and brain fog, often not discussed by clinicians, but clearly very important to patients. Now, I mentioned earlier about mental health conditions, and anxiety and depression are two that are very common in patients with narcolepsy. And you can see the percentages here, 57% and with anxiety, 45% with depression. However, again, when using the questionnaires that physicians use, there was a higher percentage that really had anxiety or depression. So this illustrates that many patients are not really aware of the impact of anxiety and depression on them, and that when you survey it and use questionnaires, that comes out. So again, there's this discrepancy between what a clinician may see and what the patient may see. Almost 90% of patients with narcolepsy said that depression made their symptoms worse, and that it made it difficult for them to do work, home, and social activities. Okay, so summing up this part of the survey, the key takeaways experienced by patients with narcolepsy are indicated here. As I've shown you, almost everybody completing the survey experienced some symptoms despite the fact that they were on medication for their narcolepsy. And the most common symptoms were cataplexy, daytime sleepiness, problems with brain function, and depression and anxiety. And most people indicated that these continuing symptoms were really burdensome to them and really had a big impact on their home, work, or social life. Okay, so the final takeaways, I showed these at the beginning of the study, and nearly all participants treated with narcolepsy continue to experience symptoms that impact their daily life. And some of these symptoms, as I showed you, look quite differently as to whether you're completing questionnaires that are assessing them or whether you're voicing your concerns to a clinician. So again, emphasizing the importance that although clinicians very often tend to rely on questionnaires, it's important for you to discuss your symptoms with the physician, because the results and the findings may differ from the testing that is done. So this CRESCENDO study really highlights the importance of discussing your symptoms with your healthcare provider to help you meet your treatment goals.
Thank you, Dr. Thorpy. We're so grateful to you. You always do such wonderful presentations. I want to let everyone know that this study, it was an honor to work with you and to work with Axsome. Again, repeating, this is a study that really hasn't been done before and been made public. Often these kinds of research efforts are done with pharmaceutical companies, but not necessarily with a partnership with an organization and then the results released publicly. They do help to really reinforce why new research, new treatments are super important because there are a lot of unmet needs.
We're very excited about the future because new medications are going to be coming available. And I think anyone with narcolepsy should be really excited that within the next couple of years, we're going to see major changes, I think, in the management of narcolepsy.
Well, that's a great way for us to begin to conclude this. I mean, you've been such a part of the arc of the experience of this growth in research. So we're really grateful for all the work you've done. And lastly, thank you to Axsome for having the foresight to partner with us and the third-party research firm. It was really an honor to do so. We are very grateful to you.